Some of health happens in the doctor's office. Most of health happens outside of that office.
To really affect the change for my patients, it needs to be a community-wide effort.
Start sprinkling it all over the bed.
Coming together and working collaboratively, we are going to have a great impact.
It just needs to be teamwork. Just a checkup? All right, so let's check you out. As a pediatrician in my office, I'm seeing a trend of more people being obese and fewer people having good nutrition. And we need to care about this because this is a setup for chronic diseases. Kids are not getting enough exercise, and so we're seeing actually some complaints that you would see in older individuals, aches and pains. The children are going to grow up to have high blood pressure, they're going to grow up to have diabetes, they're going to grow up to have joint pain. But now we're seeing it in younger children, and we're seeing it every day that these children are having complications of obesity, which translates to a lot of healthcare dollars. So we need to concentrate on what we're eating, and we need to concentrate on getting some physical activity.
The Health Education Council serves as the California Department of Public Health's Delta and Gold Country Training and Resource Center administrator. We know that obesity is preventable, and we also know that the problem of obesity cannot be solved within the doctor's office or within the healthcare setting alone. Health happens where people work, play, pray, shop, learn, and grow old. We're really fortunate to work closely with all of the 14 local health departments. We work with many, many churches, retail outlets, parks and recreation departments, schools, many, many different organizations coming together to lift up health as a priority. Having many, many different partners around the table is really essential. We're really trying to empower people to make the healthy choice the easy choice.
Can I get this?
Hi, my name is Bill Jensen. We are at Northside Elementary School. I'm the former school garden coordinator here in El Dorado County.
Here you go. Here you go.
The school garden has played a real important role in the school curriculum for about the last 4 years. You can see a pollinator at work here. There's this bee on that sunflower. Can you see that? That's why you put sunflowers in your garden. They plant it, they grow it, they will eat it, so they will be able to have an understanding of what healthy foods are and where food comes from. By growing a variety of foods in our garden, they can learn to sample and taste items that normally they wouldn't eat. For example, pulling a pepper off a plant and eating that right from the garden. Gives them an opportunity to expand their taste and perception of what real food is. And it will become a lifetime skill for them. Perfect, all right. People are in a position where they would like to have good food and understand what good food is, but they don't always have the ability to source that. So that's where food insecurity comes in, and why not teach the kids? It dawned on me that a safe route to school was necessary. I worked with school community, worked with the county, and today we have this 2-mile Class 1 bike path. Just a great addition to the community, as well as a wonderful way for students to get to school. Having students ride their bikes to school gives them a chance to be physically fit and be ready for the school day, and also be with their friends and have some fun. So the bike path really has many dimensions that will support a healthy community.
I'm Pastor Les Simmons of South Sacramento Christian Center in Sacramento County. Faith leaders have a pulpit. They have a platform that they impart vision, life, encouragement to hundreds of people on a weekly basis. So combine that platform with the healthy eating, our healthy active living message. You have the ability to change a person's life.
I don't know a church that's taken on faith in health and then resources in the community. If you want to be a part of that, come on, just make some noise. Praise the Lord.
Our services are charged with positive energy around healthy eating, active living, where a person could really go home with a sense of knowledge and accomplishment that they are getting the tools necessary to eat healthy and to exercise. When you look at the trend of obesity, heart disease, cancer, and you watch people generation after generation struggle with these issues, it has moved me to stand in the middle of it and partner to make a positive change. As a result, we saw the overall health of our community change. You had people losing weight, you had people putting the emphasis on exercise and eating healthy. We've combined health agencies, health professions with faith professions, faith agencies to equal a shared success.
Buenos días, señor. My name's Dale Ambries. I'm store director here at the Costless in Stanislaus County. We've implemented the Harvest of the Month program. The first item that we ran was jicama. We increased our sales over the previous year by 300%. Was just phenomenal. As a retailer, you look at that, you say, that's great.
The Harvest of the Month promoted at the school site. We're going to be promoting at the retail store.
This month it's bell peppers.
When we have kids coming into the store with their parents, they can be like, look mom, I learned about this specific produce. Can you buy some for me? And they will get tips on how to shop for the best items.
We have recipe cards out.
They have information in there and little tips on how they can add it to their daily meals. It's opening their eyes to new choices. We provide the education, we provide them the resources, and we empower them to make changes.
It's great for the community, great for the sales, so win-win, really.
Hi, I'm Phyllis Lucan. I'm a resident champion here at Valley High in Sacramento County. We're here at Valley High Park with Walking with Friends, and we're gonna get motivated. We're gonna start walking. We're gonna pass out food. We're gonna have a dance contest, and we're gonna rock. Good morning. The doctors diagnosed me with diabetes. So I said, what can I do natural? So they said diet and exercise. I come out here to give my part and to get healthy. And when I got healthy, then I encouraged the community to be healthy. Come on. They're coming together and they're stopping a lot of bad habits.
Walking again, boo.
It's like a family affair now. Neighbors that was right next door didn't know each other. And this kind of brought the community together. One of our participants started with 3 laps, and now she's up to 5 laps.
10 times up, 10 times down, 5 times, okay?
And another participant, she was diagnosed with diabetes and high blood pressure. And all that's gone away.
Let's do some lunges. 1, 2.
Yep, there you go, all righty.
Now we're gonna drop it. We're gonna drop it. When you put something out, then you're gonna get rewarded. And being rewarded is better health. You have to be in it to win it. Show me what you're working with.
Just during this last year, almost 80,000 residents received direct services through nutrition education, through classes in their communities, through direct one-on-one nutrition education. Our statewide data is really showing that it's having an impact. I am very optimistic that we can eliminate obesity within our generation and create a healthier next generation.